what investigations are conducted to assess male fertility. When your doctor starts investigating potential factors affecting your ability to conceive, they embark on a thorough evaluation to pinpoint underlying factors contributing to your fertility challenges. Here's a rundown of what you can expect during this diagnostic journey. Detailed history, first of all. Your consultation with your doctor dives into your medical history, probing childhood illnesses, inherited conditions, chronic health issues, injuries, and the past surgeries. This information helps uncover potential triggers for your fertility challenges. Conversations might also delve into your sexual habits and puberty experiences, giving us a clearer picture to understand your fertility concerns and steer the diagnostic processes in the right direction. Now coming up to the physical examination. During a physical examination focused on evaluating your reproductive health, your doctor conducts a thorough assessment that includes several key components. They will examine the presence, size, and consistency of your testes, which are crucial for sperm production. The examination also involves checking for the presence of the vas deferens, the tubes that transport sperms from the testicles to the urethra. Detecting any abnormality is an essential part of this process. Conditions such as micropenia, an unusually small penis, and hypospadias, where the urethral opening is not located at the tip of the penis but along the underside, are specifically looked for. These conditions can have implications for sexual functions and fertility, making them important to identify early on. In addition to these focused observations, your doctor also evaluates general health indicators that could be linked to fertility issues. The distribution of body hair can offer clues about your hormonal balance, which plays a significant role in sperm production. Gynecomastia, the development of the breast tissue in men, can signal hormonal imbalances that might impact fertility. Blood pressure is checked as well, as it can indicate underlying health conditions that may indirectly affect your fertility, such as cardiovascular health. This comprehensive physical examination allows your doctor to gather vital information about your reproductive health and identify any potential concerns that may require further investigations or management to enhance your fertility prospects. Now, talking about ultrasound imaging. Ultrasound imaging plays a crucial role in spotting any anatomical irregularities or potential issues impacting your male reproductive organs. Scrotal ultrasound helps identify issues like tumors, vas deferens absence, and varicocele. Urine analysis is also done. It helps to detect urinary tract infections that may impact fertility or contribute to fertility issues. Your doctor utilizes each investigative modality to identify potential causes and guide treatment decisions and optimize your fertility outcomes. This comprehensive evaluation enables tailored intervention to address your specific concerns and enhance your chances of successful conception. Post-ejaculation urine examination is also very important in cases of retrograde ejaculation. Post-ejaculation urine sample helps diagnose retrograde ejaculation, where semen travels backward into the bladder instead of exiting through the penis. Finding sperm in your urine after the ejaculation could signal abnormalities in the process of ejaculation itself. Now, there are certain genetic testings. In cases of severe oligospermia or azoospermia, genetic testing may be recommended to uncover potential genetic causes of fertility challenges. Blood tests can detect subtle changes in Y chromosome, while abnormalities of the vas deferens are explored for conditions like cystic fibrosis. Testicular biopsy is also done in certain cases. This procedure involves obtaining tissue samples from your testes to assess the sperm production and detect abnormalities. Biopsy results offer insights into the underlying causes of your fertility challenges, distinguishing issues related to sperm production, transport, or blockage. Now, there are certain specialized sperm function tests. These tests assess various parameters of sperm function, including viability and ability to penetrate and fertilize the egg. While not standard, specialized sperm function tests provide valuable insight into the sperm functionality, guiding treatment decisions in complex cases. Now here comes the semen analysis, a very important test. A semen analysis plays a pivotal role in evaluating a man's fertility for analyzing his semen and sperm production it contains. This begins with the collection of semen sample, usually done through masturbation, into a sterile container, which must then be kept at the body temperature and delivered to the laboratory promptly. The analysis measures several key parameters: the volume of semen, which indicates the health of the seminal vesicles and prostate, the concentration of sperm, assessing the number of sperm per milliliter of semen, the motility or ability of sperm to move effectively, and the morphology, which examines the shape of the sperm, crucial for successful fertilization. This comprehensive assessment provides valuable insights into a man's reproductive health, identifying potential fertility issues. If a semen analysis reveals abnormalities, further investigations or consultations with a fertility specialist may be necessary to explore underlying causes and potential treatments. This analysis is often a first step for couples experiencing difficulty in conceiving, offering a pathway to understanding challenges and finding solutions. Through this detailed examination, a specialist can tailor treatment to address specific fertility issues, enhancing the chances of conception.